So this is John Costa, and I'm in the basement of the Adult Education Centre here in Leicester. I'm surrounded by our doc photo exhibition, 8 documentary photographers, which we launched last night, fantastic opening, and we're here on day 3 of this 5-day exhibition. But today actually marks day 12 of our 16 days of activism, which is we use the 16 days of activism hashtag globally to be able to go around our Parallel Lives network across the majority world, talking to activists and NGOs and practitioners, both individuals and organisations that we know about activism and what they do and what their particular campaigns are and things that they're particularly focused on that we've supported through the Parallel Lives network or the Documentary Media Centre as freelance journalists. And today I'm delighted to be joined by a long-term friend, supporter and colleague of the Parallel Lives Network and the Doc Media Centre, Philomena. Thank you, Philomena, for joining us.
Thank you, John Costa.
Okay. And also someone that I was very fortunate to meet at the end of last year, nearly a year ago now, Mr. Emmanuel Edet from the CYEN organisation in Nigeria. Emmanuel, thank you for joining us.
Thank you, Mr. John.
Brilliant. So let's give everyone who's watching this a little bit of context. Okay, so as part of the Parallel Lives Network, there's an organisation locally here in Leicester that we support called Bare Earth, and Bare Earth is a community interest company, and it's very much focused on period poverty and access to period products, getting people to think about access to information, and has been very focused in Sri Lanka and Nepal through its founder, Zinfia Ganeshkapan, locally here in Leicester, who runs the Zinfia Trust organisation, the community shop and the She Inspires Global Education Hub. So we spoke to Zinfia about how we could start doing some training locally, which we started to do with some schoolwork. And then we were asked to participate in the very first Global Health Masters at Montfort University. And in amongst that cohort of people from across the world who are amazing global health practitioners, obviously, we met Philomena, and during that conversation, what came out with the sort of live briefs, we were talking about, you know, how to make a comm strategy for organisations as part of the Parallel Lives Network globally and in Leicester, was this train the trainer concept that my colleague Tina had come up with about how we could take people as individuals, give them some skills, some resources as well, for them to be able to go out into their community, whatever that was, faith-based community, whether that was a community of practice, whether that was a community around health, and run train the trainer sessions with certificates as well. So they were part of something, but just added an extra conversation to your repertoire, if you like, as a global health professional, to be able to talk to people about period poverty, both male and female, boys and girls, about these kind of subjects, and sort of a little resource pack with 4 activities that you could do. Now, Philomena, you participated in the first one. There was about 12 or 14 people, I think, in the very first one at the She Inspires Hub. Why did you come along? What was your interest in this particularly?
Yeah, as public global health expert, so I'm interested in global health issues around the sustainable development goals and other issues that affect people and community. So at that time, the period poverty was a discussion that was ongoing. So as such, I saw it being fit that it's important for me to be part of the training. And attending the training gave me that opportunity to be able to reach out to other people, communities, and organizations. Even here in Leicester, United Kingdom, I was able to reach out to my church community, where I was able to train 21 young persons, boys and girls. And it will amaze you to know that it was a kind of eye-opener for them, especially some persons. Some of the participants haven't even seen stamp or before, or even use it before. And one of the interesting thing that came out of that very training was the boys' involvement and full participation. And the boys were able to relate period poverty, the 6 period as Jamaica symbol. That was very, very, very one exciting thing that came out, that they could relate period menstruation to different things. So they said the red symbol in the Jamaica symbol symbolizes period, and that makes it interesting. It shows that boys male are beginning to get involved in the conversation on a period poverty, knowing fully well that it's not just a woman issue at all. It is a community issue, a national issue, and even a global issue. So haven't done that. I was able to look at what other platform I could exhibit or I could initiate the conversation. So I thought of giving back to my own country, my community where I've come from. So because of my years of experience as a public health specialist, I've been able to work for over 9 years at the community level on different projects, HIV project, family planning project, and um, family planning project and safe abortion practices project. So one of those projects where I worked as a program lead for the HIV project, I met with CYEN among the organization I work with. So I was able to leverage on that structure. I talked to CYEN, and CYEN was able to, that's Emmanuel, the executive director of CYEN. He was able to coordinate other organizations. There were four organizations, sorry, that was involved on that project in Akwa Ibom state of Nigeria. So he was able to coordinate them, and we trained them through the Parallel Life network and the Doc Media Center. We were able to train them on period poverty, and they were
we were able to do it. Yeah,
yeah,
not
that's
me.
right.
We were able to do it. Okay, so
Yeah.
let's bring Emmanuel in now. He's been sitting there patiently listening to us, and so thank you for that. I appreciate that. So tell us a little bit, Emmanuel, about your role and maybe what CYEN is as well, and then we can start talking about the period poverty specifically. But just going to give us an update on what it is that you do and what your organisation does, please. That'd be really useful.
Okay, thank you so much. It's nice meeting you again, Mr. John.
Lovely.
And on behalf of the 4 organizations that you train, it has really been a wonderful impact in the community that we are working. Children and Youth Emancipation Network, called CYEN, we are a community-driven organization that have the interest of the people within the community that we are working at heart. And it has been in our core mandate to be sure that whatever development platform that we have that will be able to change the perceptions, alleviate poverty, we actually sign in to be sure that our communities have benefited from those platforms. And one of it is period poverty. I want to say 4 things that the period poverty program that you train us directly that have done in our community. Though I had the mind of doing something around menstrual hygiene, but the idea and the concept you added has moved me beyond that to even research more on the ill effects of not taking this responsibility in our society. Take, for instance, we carry out a survey, and we find out that a lot of people may have the money, but they don't have the education, the idea of what to use. And so because it's like a natural thing that I have seen my mother, I've seen my elder sister using these without considering the health implication. And now, let me also, that's the best practice. And so one of it is that we discovered that in our community, not only that the money was the problem, but the younger sister have seen the elder sister using tissue during period. And so using tissue, toilet paper become the norm. And then beyond using pad, and so they consider pad as, some of them consider pad as is for the township people. We are not in the township. And so by this knowledge, we had to go there and also look at using a toilet paper, tissue paper, as it's called in Nigeria, during period. What is the side effects that will have on your health as a person? And so that gives us room to have community dialogue and discussions among the young person, the teenagers, and then it's not that we impose certain practice, but they have to come to the realization that what they were actually practicing was not the right one. This is self-education. So we facilitate self-education at the community level for our young women to be able to have the mindset that, okay, using tissue paper during period, good, is very cheap. But how hygienic first is the tissue paper? So if it is not hygienic, how about the fungal infection? If it overstays in your system, how much will you spend at the health services to be able to treat that? And maybe you have not discovered this for a long time. What other effects for negligence will that also amount to? And then that also has given us a platform to start talking to schools, public schools, that beyond just having access to PAD, is the school system giving the girl child a place to be comfortable about changing the period material as and when due. And so one of the success stories is that engagement has resulted in a proper sanitary outfit being dedicated for girl children into schools. That's one of the success story I have.
Wow.
And then the next success story I have on the period poverty is that I have also been able to engage with some young boys on social media platform. That one of the outings I have, the donation on PAD were actually from the boys. Some donated 1 pack, some donated 3, some donated 5. It was enough for our outreach. And then every day I am doing more research. There's something again, I went to another community and discovered there is what they use species. I said, wow, pieces is beautiful to be used. What is pieces? Using an old clothes. You recycle it, wash it. So I said, beautiful, wow, that's a nice idea. But how hygienic is this material? So I asked, how did you sun dry it? Where did you store it before you use? And series of questions. And make it to, at the end of the day, they were convinced that the pieces they were using was not actually hygienic for them to use. Yeah, more successes has been recorded, but we still have some challenges for sustainability. And then as an organization, there is what we can do at a given time based on the availability of resources. And then again, as an organization, we have also, for the 2024 budget, we have also factored that in collaboration with the other 3 organizations that have been trained, that the entire Akwa Ibom local government, we have 31 local government, are going to be reached with end period poverty in Akwa Ibom State.
Wow.
And when I shared this experience in one of the national training in Abuja with some of other NGOs, they were asking me to come and train them. So I have some people that I'm going to mentor line up. Number one is Rivers State in Nigeria. So like this morning we spoke together, I said, when he said to coordinate at least 10 organizations, I'll be invited to come and also do a step down training on them and guide them based on the successes I shared on the Abuja meeting. So I believe that though we have financial constraints and we don't really have direct sponsorship in terms of logistics to move around and other, because if you want to demonstrate the proper use of certain material, you must have the material available for practical experience. So, but then we are still trying to do our best in terms of resource mobilization to be sure that this idea is not just a one-off, that giving us a time and resources, the Akwa Ibom State, at the community level, everybody mentality will start working right. So what they should use and how they can end period poverty. Some of them may be financial constraint. Then we have other platforms that some of the young person we have also engaged in learning of skills that we believe that given resources we'll be able to empower. And so when you have the resources and you have the right education, you will be able to apply the skill. So this is what we have done from the day of the training. I can count, we have actually accessed over 1,700 of young women that we have reached as an organization, that we have reached with end period poverty messages, not just giving out the part, but with proper education.
Wow, that's very impressive. What can I say? I mean, it's this, you know, this is okay. So my head at the minute is just like woo, like this. So I think what tends to happen is we'll come onto a conversation like this with someone and they've had some training, and then they tell you how that training's been used for their organization or some projects that are already working. Okay. And so then you have to prompt them into, you know, have you made any kind of, you know, external relationships? Have you thought about how to take that further from that talk you gave into building these things? And I think what's so incredibly impressive and inspiring and motivational about everything that you've just said there, Emmanuel, is quite clearly for something for us, you know, and I talk on behalf of Philomena, I know she can sure talk herself in a moment, but it's you do what you do with these training sessions. You know, we've done a few of them now locally, and we've done a few online, and, you know, we've done a few with people, and it's great to get some feedback. But I think you're the first organization really that has taken that concept, which ultimately wasn't money. It wasn't, you know, resources as such. It wasn't a pack. It's not like, you know, 1,500 copies of something to give out, and just realize that it's another way for you to be able to have a conversation with people that are engaging with your organizations and existing relationship you have, but not just locally that you can see, but beyond that and beyond the borders of your state, and then taking it national and stuff. And I think that for me is the case study. That's the reason for doing it. It's not about one can tell one. It's the fact that one can tell many and others tell other people. And it's the conversation that you've had between different generations of ages, you know, young people with older people at home having that conversation. But for me, it's you know, it's the gender, you know what I mean? It's having those conversations that your sister, your mum, your auntie, your younger sister, you know, understanding that young men are kind of having that conversation and then making donations themselves as well. And with, of course, with women, you know, half the population around the world globally are kind of female, and because they can reproduce, therefore they're affected by, you know, menstruation, and they have periods and all that sort of stuff. There's that kind of, this extra cost that you have for women because of that. So women have this burden of the extra cost, the medical concept of it, as you like, and then the fact that men don't really understand because they're not part of that process. And I think for me, that's what you've just described there is so impressive, is the fact that it's able to achieve all of those things. I mean, Philomena, have you got some comment on that?
Yeah, I'm so dazed and I'm so impressed for the incredible work that CYEN has put on. Yeah, I know the other three organizations are also doing some things in the background, like Glocare carried me along on one of its activities. But CYEN, thank you very much for all you've done. It's all about normalizing the conversation, which you are already doing, taking it to the national level. And I would say if you want our support to be in such step-down training, I and John will be happy to support you in the background to help you know. John is always, I can speak on his behalf on that. John is
Thank
always
you.
available, he's always ready to help. One thing about John is he wants to see people at the community level grow. So he believes on the bottom-up approach. So that's why I'm speaking on his behalf. John, sorry, sorry for just taking you
That's
on.
okay.
I know you can do it and you will do it. So if you want us to support you when you want to do the national level step down activity, yes, we can plan along with you and support you in that regard. So thank you very much. But one quick thing for me, Sian, it will be nice because I know this recording could be shared globally, So you could tell us more about your thematic area and your area of coverage, so people can relate to what you are doing as CYEN, other than just this period poverty that you've elaborated on. Thank you.
All right. Thank you so much. Yeah, for the thematic area, we are working. Let me start with the coverage. At the moment, we are working in the 31 local governments in Akwa Ibom State.
Nigeria.
It may not be the same project in each of the local government, different project phases. In 10 local governments, we are working with HIV treatment, case identification, prevention, and treatment. In the other 2 local governments, we are working on OVC, Orphans and Vulnerable Children Interventions, that has to do with who is an orphan, who is a vulnerable child, what are they lacking, at what space would we come in to close the gap, to reduce the level of their vulnerability. At some LGA, we are looking at the gender-based violence, where it is rampant. Take, for instance, the riverine. Madam Philo, you were in Akwa Ibom, you know, when it has to do with gender-based violence, we know Oron, you know Ipono, you know Mbu, Eket, and all these places. So, so we are also into gender-based violence, and we have had a relationship with the Ministry of Women Affairs Gender Unit, where we report cases that we have found for proper follow-up. And then we also work with the Nigerian Female Lawyers Association in Akwa Ibom State. And the police are also being carried along for enforcement. And I think 3 months ago, we had a case in one of the LGA called Etimekbo, where a girl child was raped, and we were informed by our community volunteers. And immediately we sent a message to FEREP, the female lawyers. We also sent a message to the DPO in that local government. And we also intimated the Ministry of Women Affairs, the gender department. So it was so amazing that the DPO, Deputy Superintendent of Police, had received a call for this particular case over 3 different bodies. calling him on this particular case. So the perpetrator was arrested. And what we are trying to do now, beyond just arrest and maybe give sentence to spend some years in the prison, we look at the mental health development, whereby they should be given a proper mental reorientation. Because after the prison term being served, the perpetrator may still come back to the society and still carry out the same thing. So the mental reorientation, mental health issue also coming. That's another sector we are going into. I'm still doing more research, and we are still doing some organization that we can partner with for the of knowledge on mental health issue. Because some activities or some crime committed naturally for a man may not be there, but maybe there is something wrong upstairs. Maybe the man is not stable. Maybe the person is not stable. So certain occurrence. So we need to also work in that direction. Again, we are also working around like 1st of December was the Women's Health Day, and which we participated with SACA to also sensitize the community, educate the community. Currently, there is a program that I'm also working in some LGA. In Nigeria, we have the National Homegrown School Feeding Program. A lot of families have actually digressed from using the available resource material for preparation of balanced meal for children. So we are actually doing a campaign. What do you have within your environment? At what nutritional value? How will that be able to contribute to the proper development of a child? So that's the campaign ongoing. And I have been privileged to work with women across the 31 local governments. And so we identify the nutrition component within a given environment. What is in LGA may not be the same in LGA B. What is building the immune system of children in community A may differ from what is building the immune system of children in community B. And so we identify this and try to foster this so that instead of giving the children the quantity and ignoring the quality. So that is another drive that we are also diving into. And then currently, I'm also working on institution, trying to strengthen capacity of health workers. Is it in terms of consumable? What can we leverage in working with ABC partner and support the health sector to be able to do their work well and become a check in the system for the government, though we are not doing paid. All this because we are signing as a voluntary organization, a charity organization. So we become that check in the system for government. So we have worked in the law reform, we have worked in overseas, we've worked in HIV, we've worked in gender-based violence. So these are activities that we've done as an organization. These are the thematic area we have done. And now currently, we are also doing something on mental health.
Brilliant. So listen, Emmanuel, thank you very much for taking the time to talk to us today. Yeah, with all of those themes, I'm sure you're incredibly busy. And I know that Philomena, sitting there in the PhD research hub at the Montfort University, is undertaking her journey now around mental health as well. And so we've got some nice connections again for us to be able to move forward. I know that, you know, we've recently got a contract from the National Health Service here, our local regional NHS, to do some research and consultation with young people between 11 and 25 around accessing mental health services and stuff. So there can be some stuff that we can share with you as well. There's some shared learning. Maybe we can do a session online as well with some young people. I think going forward it'll be quite interesting, yeah, and how we use pop-up consultation and sharing some of those tools with you. So for me, firstly, it's wonderful to catch up with you. Two, it's inspirational to hear what you've actually done with that kind of very basic session that we were able to do on Zoom. Unfortunately, we weren't even able to do it face to face. And certainly I'd love to be able to return to Nigeria, because I remember it fondly at some point in the future to do something with you, maybe a conference or something like that. We could work on pulling something together with some of your fantastic connections, both locally, across your states and nationally, as well as you were saying there about Abuja. So for me, I'm delighted to see you. Thank you for such a positive response to it as well. And I look forward to catching up with you in early 2024, hopefully with some other activities. Thank you very much.
Thank you.
Thank you.
Thanks, Philomena.
Thank you, John. Good to see you.